People wake up on a normal day and suddenly something happens that changes their lives completely.
Paediatric trauma call, 15 minutes.
A lot of really bad things happen to really good people, but you never think it's going to happen to you.
Stabbed 5 times, including chest, and he's got an arterial bleed from his leg.
High-speed RTC moped into a wall.
Jesus Christ, what happened? You all right?
I love my wife.
Any reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Complete baloney amputation of her leg.
I can't breathe.
He looks frail, doesn't he? He looks like somebody who's going to break.
It's going to be one of those days.
A place where life,
Darling, what's for dinner?
love,
It's still as beautiful as ever.
We have a boy.
and loss
Don't make me cry.
unfold every single day.
And they said there's nothing they can do.
All the patients you're about to see were treated in just one 24-hour period.
You don't know how lucky I am to be talking to you right now.
We see situations where someone's life has just been turned upside down. People always try and remember what the last conversation was, or the last words that that person said to them. And I suppose it's so much nicer if the words that they remember are, "I love you."
Hello, morning. Do you know where to use Samsungs? Where's the last number redial?
It's in the logs.
I found it finally. I'm not mental.
All right. Thanks for sorting that out.
Working in A&E today are two of St George's most experienced consultants, James and Will.
St George's is a terrific place to work. There's fantastic nurses, although we don't always tell them that to their face. I stole one. There was an empty bed next door. I just took it. Don't tell the nurses. Oops.
Tell the nurses what?
Nothing. It's difficult for patients sometimes to see staff in the emergency department having a bit of a joke with each other.
Are you here to humiliate me? What do you want to do?
And sometimes people complain, say you shouldn't laugh. This is a hospital. It's a serious place.
I was teaching medical students. I said, come and have a listen to the heart sounds. And, oh, yeah, I can hear. Yeah. With it round there. Really? Yeah, with his neck round there like that. Isn't that
it's something that really helps you get along as a team. It helps forge those relationships that you count on when things get really under pressure.
I've got the bleep. If there's a trauma, I'll come back.
The confidence of knowing that your colleagues are there for you is fantastic.
How are we, dudes? Boom.
I think that we all want to be loved and cared for. And we see it's really important for our patients as well to have somebody who loves them, somebody who cares about them.
It's very good of you, darling.
Yeah, well, you spent long enough looking after me.
They will immediately feel better. You know, that's not a drug that we've given them.
Yes, I do.
Just somebody being there, holding their hand, giving them that love will make people feel better.
Hello, St George's. You see, are you Hems? Helicopter, Air Hems, okay. 66 male, yep.
A 66-year-old man is being airlifted to St George's, having fallen 10 feet from his loft, through his banisters and down 2 flights of stairs.
I'm at 10 corridor, air 10 minutes.
man lives alone, but managed to alert his neighbour who dialed 999. Helicopter medics are concerned the man could have suffered neck and spinal injuries. He also has a significant head wound.
Before they arrive, you've got some ideas about the type of injury that they're going to have. If they've fallen a decent distance, you have to make sure that your mind and your eyes are wide open to all variety of injuries.
So he's come about 12 foot out of a loft and then smashed through a banister.
Yeah, the banister is like a comedy sketch. Like the bottom was like, you know, he'd come down and then through the banister and all the way to the bottom of the stairs as well.
You know, if somebody's broken their arm, they'll say, my arm hurts, and it might be at a funny angle. That's easy to pick. They may have an injury to their head, to their neck, to their chest, to the abdomen, to their pelvis, to anywhere. You're not really sure what it is. Our priority is to find out exactly what those injuries are and how extensive they are. And we do that by taking these patients into our CT scanner straight from the pad.
You're at St George's, I'm Will. Yeah. All right, what we're going to do is just going to move you across onto another table, which is our CT scanner.
Yeah.
Fantastic.
Gerald, he's 66. Just before 9 o'clock this morning, he fell out of his loft. He also then subsequently fell through a landing, walked to his neighbour's house. The elderly neighbour said he looked really dazed, very grey and bleeding from his head. They phoned the ambulance. He's got a probably 10 to 15 centimetre full thickness laceration over his head and a tender clavicle on the left.
So I'm a little bit worried. I think we're just going to do him all. He looks a bit frail. Is that all right? Yeah. Gerald, we're just going to get you scanned, sir.
You can throw as much science as you like at it. There's a lot to be said for the human side, the emotional side. That's what our job is. We need to provide that love and emotional support to our patients sometimes.
66-year-old bachelor and trained lifeguard Gerald has a serious head wound, but doctors are most concerned he may have damaged his neck and spine when he fell from his loft. Consultant Will is reviewing the results of Gerald's scans.
I think you fall 20 feet onto something hard and you just get a cut to your head and you break your collarbone. I think you got away with it. You are pretty lucky.
Other than a broken bone, scan results show no other internal injuries.
Scans look good. Right. Just on that first look, it looks like you've broken your collarbone. Okay. What were you doing in the, were you up in the...
I was up in the loft and I've got the computer and paper, like sort of an office up there. And I come down backwards and I think I just missed grabbing the rail and then went.
You just feel a bit of an idiot, feel a bit stupid when you're lying there.
And I remember sort of coming to at the bottom of the stairs with blood all over the duvet that was was around. And a broken pitcher with glass around.
My cup's always half empty, not half full.
So then I sat on the steps and I walked round to the neighbours.
I said, I suppose I'm accident prone. I used to like water skiing and I used to be the entertainment on skis as well.
Anything else hurt? Do you want to bit your hands and your legs?
I had a ski flick up once and hit me in the eyeball, so I had to go. I thought I was blind for a day.
You got some little abrasions just on the back of this hand.
One of the worst ones was when I was run down by a horse. They think it was the knee of the horse that caught my head. I had scrapes and holes in my clothing through to my skin where the hoof had gone through. These things happen, and you never know what the result's going to be.
And the knee's okay?
Yeah. Mum lives about 15 minutes away by car, I suppose, in Ashford, and she lives alone, quite independent. And the neighbours are good. If you need help, it's nice to be able to have people around you that you can ask. You know, sometimes they say, no, I can't do that, and then you ask somebody else.
So we're going to take this off and we're going to have a look what we've got underneath.
Gerald will need the wound on his head assessed before doctors decide whether he'll need surgery.
Oh dear.
Oh look, my comedy vegetable.
Did you grow that?
No, I can't grow anything apart from weeds and snails.
A&E St George's. Adult paediatric. Yeah, go for it. 5-0 female.
A 50-year-old woman is being rushed to St George's after being hit by a car near her home in Croydon.
Do we know what kind of RTC it is? Okay. Thank you, bye. She was the pedestrian versus the car. Adult trauma call, 20 minutes.
The woman is fully conscious, but has a suspected open fracture of her right leg.
Oh dear. Bev, I'm Will. So again?
She's 50.
She's 50? She's not, she's lying. Huh? You're joking. Girls, I'm going to be really rude. Do you mind just staying in there just for a second, just while we sort her out? And then I'll get... Are you or her friends? I was going to say sisters. My goodness, you do it well. So this is Bev. Good.
She's run out between two parked cars into an oncoming car, possibly going around 20 miles an hour, has run into the side of the car. There's minimal damage to the car. The only injuries we can find is an open fracture. It was bleeding quite a lot when we got there, actually. She's had 10 milligrams of morphine, N-Schnox, 1 gram of paracetamol and 400 milligrams of ibuprofen.
So we just do a quick primary survey and then and that'd be great. We just get the bloods. I can't believe you're 50. Your mum doesn't even look 50 outside either.
Beverly's mum, Annette, travelled with her in the ambulance, and several other family members have arrived to be with her.
The bone was shooting out here. This was there. Yeah, just above there, and that was sticking out.
We come from quite a big family. My nan has 6 children, and those 6 children have probably about 16 or 17 children between them. And then Granny's got about 7 or 8 great-grandchildren as well. We don't always get to see each other all the time, but we're always at the other end of the phone for each other if we need it.
Beverly's open leg wound is being assessed by orthopaedic specialists.
It's interesting when you get the story. So there's a car going past, she's run into the car and fallen backwards. What I would do is we would just get around for an X-ray as soon as possible, and then we make the diagnosis.
When I heard her bone was sticking through her leg, I was like...
Beverly is being taken for an urgent X-ray and could require immediate surgery to repair the bones in her leg.
We've just all been there to support each other. So I couldn't imagine not having that network of support around you. It must be horrible.
In the emergency department, life does come into kind of like sharp focus when people need other people the most.
66-year-old bachelor Gerald was brought to St George's by helicopter after falling from his loft. He suffered a fractured collarbone, but also has a significant laceration to his scalp.
I'm going to have a look at your head now. We're going to get your head stitched up.
I now rely quite heavily on my wife and her family, along with my 3 sisters, my brother. It's a big network. I sometimes rely on my kids as that kind of emotional support, that one that I might use them to de-stress on by just going to go and do something silly with them. And that's just the way it works for me.
How long does it take the collarbone to fix?
6 weeks, 6, 8 weeks.
So that means no swimming for 6 or a couple of months.
Is that what you like to do?
I'm the treasurer of a lifeguard club, so we sort of teach kids to drag people out of the river and stuff and resus and things.
We'll see a lot of people who come in on their own, and you probably do spend a little bit more time with them. I think patients probably do feel quite lonely. They're on a trolley, sitting in a brand new environment, an emergency department.
Are these the sewing stitches or the staple things?
Sewing stitches. I'm being kind to you.
And so just investing that little bit of extra time, talking to the patient in a human way rather than just a doctor-patient way, is good for them and it's good for me.
Gerald has worked as a polo club official in Windsor for the last 30 years.
And the vet at the polo club, I've held horses when she's stitched up their cuts and things.
Oh, yeah. So have you met all the players? Do you get to meet the royals and people like that, or...?
The Queen was up there last week when she's always there during Ascot week.
First name terms?
No. Harry and Wheels was different when they were kids, I knew them.
Really? Nice.
I'm chief steward timekeeper. Try to prepare, get everybody ready, make sure everyone's there to start the match. Harry and Wills, as children, used to come up to the club with Diana. And the boys would be in the back playing doctors and nurses with the ambulance people. Thing is, when I go home, I've got a broken banister, apparently, a duvet covered in blood, and glass all down the stairs where the mirror...
Do you live on your own?
Yeah.
You got somebody to give you a hand with all of that?
Yeah, the neighbours are pretty good.
So have you got anybody to come and pick you up?
No, not right this minute.
Have you ever been married?
No, just never went that way. Came close once or twice, I suppose, but sometimes the way my life is, I sometimes think I'm probably better off without them. The fact that you're on your own, it also makes you think about perhaps what you should and shouldn't do. Oh. Sorry. It's all right. You do sort of think differently about how things could have been. And I would like to have had a couple of kids, but life's not gone that way. Everyone says, oh, you're on your own, it's easy. But you don't have somebody to share those experiences with. The good and the bad ones. And that's I think, the main thing I would say I'm missing now.
Good, all done. You've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 stitches.
11, right. And if there had been someone around when I fell, I might have got the ambulance a bit quicker than having to go next door or knock on the door.
Gerald will now be taken to a ward to be monitored before going home. X-rays have confirmed 50-year-old Beverly has fractured her tibia and fibula and requires emergency surgery. Her 80-year-old mum and 5 other members of her family are waiting to see her.
Nanny, would you like a sandwich we got?
What do you have?
We've got 3 wraps.
When we was younger, Auntie Beverly took us to Ipswich, me and my cousin Stacey, on the train up there, and it was just like a big adventure. I'd never been to Ipswich before. She's always really tried to be a hands-on auntie. And she forgot the bag on the train with all of our shoes in it. I remember that, definitely.
And I managed to go 50 years, well, 49 years, without a break, a scratch, nothing.
You don't look 50 at all. I see you like 30, 40. Go for that.
You know what, I love you. You know, I'm meant to be going away this weekend. It's like a dancing weekend, you know.
Well, Auntie Beverly's always up for a dance. She's always up for a dance. She plays some music and she's going for it. She's one of the first on the dance floor, always.
You've got a nasty break off that bone. So the options are either putting a plate on it and it goes along your ankle joint and then up, or pins in your legs with bars connecting them.
Oh, it's quite a nasty accident.
Exactly, yeah.
Well, Auntie Beverly's a strong, independent woman, you know, always positive, got a joke to tell or story to tell or something like that.
To prepare her for surgery, orthopaedic doctor Avtar must realign Beverly's broken bones.
Okay, you guys are good to go.
Good to go?
Yeah.
Can we just bend the knee?
Bend your knee. That's it. Well done, Beverly. You hold my hand. Keep taking nice deep breaths for me.
Failure to manipulate them into the correct position could risk permanent damage to her leg.
She's not relaxed enough.
Is she a bit more relaxed? You want a bit more?
She's still too tense. You drop the bed head.
Jess, can you just open this up for me, please?
Still a bit tense.
Take nice deep breaths for me.
One sec. Let's just...
I'm still hungry. What's wrong with me? They got worms. Can you x-ray me for worms as well, please?
Yeah.
Do you reckon a worm would show up on an x-ray?
I don't know.
No.
Can I bring you one from urgent care?
Fine.
He's just he's in a lot of pain. He's been carrying a sack of tiles and he's just done that, and a tile has cut him from here to here. It's just gone through and he's lost all of his flexor tendons.
Paul, a father of 6, is being rushed through to resus. Consultant Will is concerned a cut to his arm has resulted in significant nerve damage and needs specialist treatment.
He's in a lot of spasm and he's got an awful lot of, I mean, he's crying in pain and he's a tough old, but he says his sensation's not quite normal, but he's sensate to his hand. I'm going to leave him because all I've done is hurt him more. We haven't made friends. So Dr. Cameron, he's much more gentle, much nicer than I am. I'm sorry. Okay.
It quite often happens that you get someone that hasn't even made it into resus, who's been moved to another area, who you think, actually, the person with the worst injury right now is the person in the minor injury unit. Hi there. I've heard you've got an awkward cut there.
I need to make a plan.
Yeah, for sure.
I need that.
For sure. OK, of course, obviously it's vital. What do you do?
At the moment, I'm picking up people's rubbish and throwing it around, but so I'm going to need both hands.
Of course, yeah, of course. Whatever you do, you're going to need it.
Cars.
Yeah.
I need
so,
spanners.
Yeah, don't worry. Relax.
Sorry.
So just, no, that's all right.
I'm just going to put a little tube in this arm just so we can give some pain relief. So just relax that arm with that.
Yeah, I will do as soon as you get the needle.
Yeah.
Don't you worry.
It's nasty when you get an injury like that. You don't know what that injury is going to mean. Could they have damaged a nerve or a blood vessel, or is there something else going on that we need to be worried about? Tell me again what happened?
It's a bad ceramic tiles. One of the tiles must have been sticking out. It's sliced through my arm.
There we go.
Is this I'll go home later, Jobby, or?
I don't know. We'll have a look and see what's happened to the nerves and the tendons and everything.
Paul is one of 4 siblings. He began working as a rubbish clearance driver just over a year ago.
Paul is a worker. He's not the type to just sit at home and just get money for nothing.
Can you make a fist with these hands?
No.
OK.
He's a grafter, so he does like to obviously use his hands.
So sometimes where you've got the muscles in your arm, they're the ones that move your fingers. So if you've got an injury here, if there's damage to the tendons, then it's difficult to move the fingers, right?
Consultant James needs to determine if Paul has suffered any long-term nerve damage to his right arm.
Can you make your fingers go straight? Can you straighten them out? I just wonder if it's because it's just so tense at the moment. I think the main thing is how apprehensive he was, what the injury might be. There's some injuries which stop you working, and I guess that's what he was worried about, which makes the pain worse. Can I bend your fingers down? Is that very sore?
Ow!
OK. Just relax. Just relax. You're holding your breath and tensing up. That's the opposite of what I'm asking you to do. You're doing really well. It's going to be all right. We're going to give you some morphine through the drip, take the edge off it.
My sister Dawn was the baby of the family, so obviously we were all pretty close. And Paul made sure that we were spoiled a bit with like presents and keeping an eye on us and making sure we were all okay.
All right. No, I mean, the cut itself is very clean, but it does look like it's involving the muscle underneath.
I'm more worried about whether my hand can work again.
I know the plastics guys are going to want to have a look at it. You try what you think will work best to stop them worrying about what might happen and just deal with what's going on right now. When you want to reassure somebody, you don't want to say to them, don't worry, everything will be fine, because it might not be.
Apparently, running triathlons, or doing triathlons, is the new midlife crisis thing.
Really?
50-year-old Beverly has had a procedure to try and realign her broken leg bones before she can have surgery. Her family have been waiting to see her.
Hello, sis. I missed you on Saturday, you know.
That's all right. Don't worry about that.
Thank you, sis.
That's all right.
And you look pretty.
Thank you.
So we can't go dancing tonight? That's what I'm thinking. No, I won't be going dancing. I won't be dancing anywhere.
My 20s and 30s, I had fun, fun, fun. I had no responsibilities and just embraced life and travelled. I had fun.
Oh, well, Mummy, I'll break your record. What? None of your children ever broke any bones. No, never. But until now.
I really wanted to be an air hostess when I was a teenager. And then when you sat down and you did a bit of research into it and found out what it was about, it's like, no, I don't want to be a waitress in the air.
Take some time to heal.
I decided, I wanted to be a model. So I did that for about 5 years. And then I put my sensible hat on and got myself a sensible job.
One of the ladies was saying, oh, are you the one with all the people? I'm like, I don't know, but This one on with my neighbour out there.
Is Aisha
about 7.
Aisha, Charlita,
Oh, okay.
Stacy,
Wow.
Roxanne, and Aisha, Andrew's on her way.
Wow.
In the emergency department, there are some patients who have everybody. It's rather nice to see, actually, especially when it's big families, and seeing that love and that attention and emotion being expressed for a family member is heartening. We all feel better if we have that support around us.
All right, see you in a while. Somebody else will come in. Okay?
Okay.
Thank you, love. I'm very close with all my brothers and sisters, and I'm very fortunate that we are, because there's so many families who are not.
Oh, hello. Hello, Stace. All right, darling. Thanks for coming.
You were saying it's a good thing you had your little boogie on Saturday night, because you're not dancing again for a little while, are you?
I'm meant to be going away this weekend.
I was just saying that. Oh. Still go. Take your painkillers.
Yeah, you can still
Just
go.
go and sit in the corner and...
Yeah, go for the
corner.
We'll
get you a little Zimmer frame. We'll get you a Zimmer frame and you can just do a step, do a step.
Before they can operate, specialists need a CT scan of Beverly's shattered tibia and fibula to discover if they've been successfully realigned.
I find it very strange when some of my girlfriends tell me that, oh, I hate my sister, or we haven't spoken in years. It's like, why? Why? They're your, they're closest people to you. It's weird. Life is far too short to not talk to someone.
I want to do my knitting. I want to do my knitting.
Hey?
I want to sit and do my knitting.
What's wrong?
I want to do my knitting.
Just knocks it out in here, Brent, I'm telling you.
What, your hearing aid?
Rubbish clearance worker Paul has suspected nerve damage to his right arm after cutting it open on some building rubble. Plastic surgeons are being called to assess the injury.
Hi there, James, one of the consultants. I've got a 39-year-old guy called Paul. He has a nasty cut to his right forearm. He's got decreased sensation in his little ring and middle fingers and on the tip of his thumb. So I think it looks like something you guys are going to have to repair in theatres.
OK, Paul, so how are you feeling?
Yeah.
How's the pain?
Pain's gone again unless
Pain's
I'm
gone.
moving it, but...
Perfect.
It's this job. I didn't realise it was so dangerous. I thought it was just, driving a truck and picking up people's rubbish.
Yeah.
Maybe the odd sofa.
As long as he's working and he can earn the money for his family, then he'll be happy. He is a good dad. He probably buys them more things than they need.
Pixie's all about going fast. She's going to be 4 on Sunday. So I've got a race car. So, yeah, I found this. It's a pedal car from Germany. So, yeah, I've got that, and it's pink. I'm going to put purple flames on it, and then she's got a race car. There we go.
Wow.
Granted, saying that means I was intending to build it on Sunday. I don't know if I'll be able to now. I can't move my hand.
A member of the plastics team has arrived to assess the damage to Paul's arm.
So my name's Jess, I'm one of the plastics registrars. So when you're just resting there, do you get any pins and needles sensation?
It still feels a little tingling now.
Okay, can you lift your thumb up towards the ceiling at all for me? Just won't move. Okay. Can you try and see if you can make a fist at all with your fingers? try moving them at all.
If you do have a nerve injury, then that's something that the plastic surgeons take really seriously because they know what a consequence it makes to that person.
So in terms of the symptoms that you describe and what we can see, we have to be suspicious that one of the main nerves in your arm could potentially have been damaged. Now, that's not for certain at all. We have to look inside by means of an operation and check the nerve and see whether it has been damaged or not.
Okay.
And the other thing is that you have some muscles in your forearm which become tendons in your hand, and they're structures that allow you to move your fingers. And we need to check those to see that they're intact and that they haven't been damaged as well.
If Paul's not able to work, I don't think he's going to feel like his children can look up to him like he looks up to Dad.
I'm gonna fix it.
Occasionally, if the major nerves have been damaged, even over a prolonged period of time, normal function doesn't always completely return, and it depends person by person. So very much depends on what we find at the operation.
I think he puts on a brave face because, you know, he wants everyone else to be okay. He doesn't want people to worry about him. I think we don't realise how much he wants to look out for us.
Thank you very much.
Surprised how many people bring their children down, isn't it, late at night?
Well, they have to, don't they? Do they work all night? They work all through the night?
They work all through the night.
Paul is undergoing emergency surgery to try to repair any nerve damage and restore movement in his right arm.
Ready, steady, slide.
This is Paul. He's been consented by Jess for exploration under anaesthetic, repair of damaged structures to the right forearm.
He just had a brief slip and a very quick accident that happened sort of out of nowhere, and all of a sudden you're in hospital, and that might threaten your career. If you're really reliant on your hands and what you do with them, that's a much more scary proposition.
We're all like quite a close family. He did open up a sandwich bar and was excited about having a cafe that both myself and my sister Dawn could work in and be working together as a family.
Okay, so that's his radial artery there, I think.
He put a lot of effort into it to make it how he wanted it to look, and getting the floors, doing the painting, the windows and the sign. But Dawn, she first got ill when she was 12, and it was cancer of the leg. And then it came back when she was 18. And then it came back a year later, and then came back again a year later. She passed just 2 weeks before it got opened. So it was in memory for her. Paul sort of because he was always there for both of us, I think he sort of self-destructed a little bit himself, and I think he was just trying to be strong for everyone else, and didn't grieve properly himself, and then I think that's why it took him so long to get over it.
Augmentin is fine if you've got it. Okay, let's just give it a little bit more of a wash, and then we're done.
Paul will now be taken to a ward to recover. It'll be several months before doctors know if he'll regain movement in his hand.
Watch this.
No, thank you. I don't want to wear it, I want to drink it.
No.
I'll get chicken and chips tonight.
No.
Close at 11 o'clock. What we got to eat indoors?
Hummus.
Who?
Hummus. Why is that going wrong?
Oh, God. Keep your ears open, Glenn. Never pay.
We're going to call you soon.
Yeah, I know.
Beverly's scan results show the realignment of her tibia and fibula was successful. Surgeons are preparing to operate to try and fix the bones.
Is it quite a bad?
I mean, it's worse than sort of a normal ankle fracture.
Okay.
But I mean, it should be that she can have an operation, and then I imagine they've actually got some plates in, so some bits of metal in.
Okay.
The doctors there will be able to give you more information.
Oh, that's brilliant. Thank you. Thanks. Okay.
Oh, so yeah, they are going to operate on
Yeah,
me.
they'll operate, but the orthopaedic doctors will explain more when they look at it in detail. It's like you've broken in one place, and in the other place it looks like there might be a bit of shattered, not just broken. So it's slightly worse than the average break.
Let's watch where I go.
You're in the best place. You're in St George's. It's like one of the best hospitals. So that's good.
I'm very fortunate because I've got the support of family and friends. I'm just lucky. This is the first day I put on danglies, just to get you run over. Got to look pretty.
At least your toes look pretty though, look at that.
I know.
You look gorgeous.
I was like, oh, please don't take off my nail polish.
After you just got it done for your birthday.
Yeah. You create good relationships with people, and I think it does carry you through the world.
Look at you lot. Are you going for surgery today?
Yes.
And look, and you're dressed for surgery as well. You're still in your dress. You've got your earrings in.
Got my earrings in.
She's been sedated. She's had that. She's been through the
Nail
scanner,
polish.
and you're not even out of your dress. Look at that. But I'd get rid of some of the bling.
Yes.
Give it to you. Give it to.
Off your bracelets and so on.
You all right?
She's got a pain in her leg.
Yeah, my leg's just killing me all of a sudden.
It's a surprise. It's just broken. But yeah, we can get you. We'll get you something else. You go.
You know, the biggest thing for me, which was such a shock, when I had my accident and I was in hospital, I think I was on a ward for a couple of days, and there was this older lady in the bed opposite me, and she was just so amazed that I've had all my family and friends. I just had a stream of people coming constantly, all the time, until it was time to go home. And one day she just said to me, oh, Bev, do you think your visitors can come and visit me? And I was in tears. I mean, I'm emotional now. It was just amazing, just to think. There's me with all these people visiting me, friends, family, everyone really, and she had no one to visit her. It was horrible. It really was horrible.
It's nice to have something to share just, you know, moments of sadness and happiness, and having somebody who you know and trust close to you gives you a sense of peace and a sense of quiet and a sense of, do you know what? I will get this. I'll get through whatever is going on now. You know, we all have to have a kind of a social structure around us to keep us human.
I go back up the ladder, even though now there are more handles to hang on to. I don't take cups of tea up there anymore.
She's just going to keep getting stronger and stronger. She's very determined. She wants her 2 legs back and she's going to get them. She'll be slut dropping in no time, if you know what slut dropping is.
I can move the hand now. It could have been a lot worse than it was. Hopefully it'll improve and I'll get better in time. Fingers crossed, but not the right hand, yeah.